Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. Today, we're going to talk about the Affordable Care Act being under attack in the courts. But before we do, let me point out that down below in the YouTube description box, you'll find a link, which is the URL address for the Healthcare Advocacy newsletter, daily newsletter, free. You can subscribe there, go there and subscribe. And it is the text for today's video. In there are all the links to the stories and background material, studies, and the actions that we take. Although I will tell you that separately, I'll put the actions in the YouTube description box as well. So let's get started. Let's first talk about aspirin. In a study recently of more than 100,000 people, researchers found that people with a less healthy lifestyle, so that means higher body mass index, greater smoking, greater alcohol consumption, less physical activity, poor diet quality, they had a greater reduction in the risk of colorectal cancer associated with aspirin use compared to participants with a healthier lifestyle. Participants with a healthier lifestyle had a lower baseline risk of colorectal cancer, and the benefit was less pronounced. The study's findings could encourage a more nuanced approach to preventive aspirin use. This comes out of Massachusetts Brigham General Hospital. There's a link to that there. Before you start gobbling down aspirin, just talk to your doctor first, because it has blood thinning effects, and that can be unhealthy. But so talk to your doctor. Let's talk about cancer and young people. This is a study that was all over the news this week. Generation X and millennials are at an increased risk of developing certain cancers compared with older generations. This is a shift that is probably due to generational changes in diet, lifestyle, environmental exposure, a new large study suggests. The study was published this past Wednesday, a couple days ago, in the Lancet Public Health Journal. Researchers from the American Cancer Society reported that cancer rates for 17 of the 34 most common cancers are increasing in progressively younger generations. The findings included cancers with the most significant increased risk are kidney, pancreatic, small intestine, which are 2 to 3 times as high for millennial men and women as baby boomers. That's horrible. Millennial women are also at higher risk of liver and bile duct cancers compared with baby boomers. Although the risk of getting cancer is rising, for most cancers, the risk of dying of the disease has stabilized or declined among younger people. So that's good, but mortality rates increased for gallbladder, colorectal, testicular cancer, uterine cancer, as well as liver cancer among younger women. Researchers analyzed the data of more than 23.5 million patients who had been diagnosed with 34 types of cancer from 2000 to 2019. They also studied mortality data that included 7 million deaths from 25 types of cancers among people aged 25 to 84 in the US. What this means, if you're not a statistician, the law of large numbers comes into play. These numbers are so big, which means that everything they're talking about is statistically significant. Screening for cancers at a younger age will help mitigate the damage, as will having both doctors and patients be aware of the increased risk. That is super important. That way symptoms are not dismissed with no thought to cancer being a possible cause of the symptoms. So what that means, if you present to the doctor and you have symptoms that in an older person could be cancer, or at least point to it, the doctor looks and says, "You're 25, that shouldn't bother you," and they wipe away cancer off the slate. They can't do that. They now have to start thinking of that. Okay, there's a link to the story. I think this one was in the Washington Post. Let's talk about pharmacy benefit managers and the Congressional Budget Office. On May 23, 2024, the House Committee on Budget convened a hearing at which Chapin White, the Congressional Budget Office's Director of Health Analysis, testified about how consolidation among hospitals and physicians affects the federal budget. After the hearing, Chairman Jody Arrington and Representatives Drew Ferguson and Rudy Yakim submitted some questions for the record. When that happens in Congress, the person testifying, like at the CBO, gets to take the questions home or back to their office, formulate answers, and then submit them, and those questions and answers become part of the congressional record. I've put in a link to the questions and answers in the newsletter. The CBO has published them. I don't want to go through the whole list of questions. If you're interested, you can go and read them if there's nothing good on TV. However, let me summarize the first one. When asked if the integration of pharmacy benefit managers and insurance companies and retail pharmacies had an effect, after lots of weasel words from the CBO, the answer was that if PBMs and pharmacies were integrated, then consumers got the short end of the stick again. Let me just briefly quote. Recent evidence on that issue comes from a 2023 study by the Medicare Payment Advisory Commission, that's MedPAC, of 6 therapeutic classes of drugs. MedPAC found that in the majority of cases, the highest prices, net of manufacturers' rebates, were paid by vertically integrated plans to vertically integrated pharmacies. I got to tell you, there are 3 pharmacy benefit managers that are vertically integrated. They have stores, they have distribution, and they are part of insurance company networks. And you know what? All it means is they're screwing the consumer. So did you catch that in the testimony? The Objective Congressional Budget Office investigation found that when the PBMs are vertically integrated, we, the consumer, get screwed. It is just another good reason to dump pharmacy benefit managers and go with universal health care, where the single-payer insurance trust will negotiate all prescription drugs. Okay, let me talk briefly about attempts to impede the Affordable Care Act. There's an ongoing federal lawsuit that aims to strike down the Affordable Care Act's preventive care coverage requirements for private insurers. It would create an environment in which insurers and employers get to pick and choose what services they want to cover and what services they want to charge for. The suit is brought by a group of so-called Christian business people who don't want the insurance plans to cover preventive HIV medications because it violates their religious rights. I'm not sure how, but I'm going to leave that to your imagination. Determining what preventive services fall under ACA plans is the responsibility of the Health Resources and Services Administration, HRSA. They are advised by the U.S. Preventive Services Task Force and the Advisory Committee on Immunization Practices. These are all government offices who make recommendations on other kinds of care as well to the ACA, that ACA insurers should cover. On June 21st, the U.S. Court of Appeals in the Fifth Circuit, and I have a link to their ruling, issued a ruling saying that the USPSTF had not properly been appointed, and therefore its recommendations made after the ACA was signed into law were unconstitutional. But they only applied this to those people who brought the case, not to the whole country. What they're saying is all the scientists who work in that organization needed to be vetted by Congress and approved by Congress. This is, in the technical vernacular, hoo-ha. Plaintiff challenges to the recommendations made by the HRSA and the ACIP, including those on contraception, were sent back to a lower court to consider. Okay, this is not happy. Reed O'Connor, a federal judge in Texas, is very likely to get the case. He is well known as the judge who issued decisions undermining the ACA, including a ruling that struck down the entire law for the whole country. Happily, the U.S. Supreme Court later overturned that ruling. He is a you can't tell me what to do kind of guy. All right, look, before my blood pressure goes over 200, you know what fixes this. It is universal health care, a public insurance trust paying private providers that negotiates all prescription drugs, covers preventive care, has built-in safe nursing staffing levels, and global budgets to make sure that facilities can keep operating. All at more than $400 billion a year less than we pay now, per the 2020 Congressional Budget Office report. There's a link to that report in the newsletter. let's take this action. This is really getting serious. Call or email your senators and members of Congress. Tell them you favor universal health care and you don't like getting screwed by these companies. You can reach them at https://www.usa.gov/elected-officials. That's in the YouTube description box. Or my favorite way, use RESISTBOT on your cell phone. Just send a text message to SIGN, SIGN, space, PRHPNZ. That's to 50409. So you send a text to 50409, and the message is SIGN, SIGN, space, PRHPNZ. And it's going to send the following message to them. I'm your constituent, and I want you to know that healthcare is under attack again. Vertically integrated pharmacy benefit managers are cheating consumers. Lawsuits pop up all over the place about what medications and procedures the ACA should or should not cover. Enough is enough. Patients have a hard enough time getting to a doctor and trying to recover without pharmacy benefit managers cheating them on drug prices or special interest groups suing the government to make sure that preventive services are not covered. We sent you to Congress to help us, so now how about it? I want you to pass universal health care like H.R. 3421 that will negotiate drug prices, cover all of us cradle to grave, and do it for $400 billion a year less than we pay now. Here are links. I include links to the Affordable Care Act report. I include links in the email to the Congress people and senators so that they can look up these stories on the lawsuit challenging the ACA and on the pharmacy benefit managers. Okay, that's what I've got for you today. Down below, you can like, share, and subscribe. You can send me comments at healthcareadvocacy1@gmail.com. I look forward to hearing from you. Have a good weekend.